Welcome to today's lecture. Today's lecture is about behavior change with a focus on risk factor management. Please note this lecture is intended for general education purposes. It is not intended to provide medical advice to any individual. Today's lecture, we hope that you feel empowered with the three following key points. 1, there are practical actions that you can take to make positive behavior changes that will improve your health. 2, making these positive changes is a process that happens in stages, a little at a time, and that process can be challenging. So, if you're feeling challenged, know that you're not alone. 3, we offer many resources to support you in this process. We can help you enhance your motivation and feel prepared to make changes. We can also help you to learn new behavioral strategies and put them into practice to make positive progress toward your goals. Behaviors is a broad term to describe actions that affect our health and mortality. Here, several critical health behaviors known to affect risk of heart disease development and management are listed. These include diet, which is what we eat, and nutrition, which is the quality of our food, exercise, structured, intentional, repetitive movements, and physical activity, which is any movement, smoking or tobacco use, sleep quality, stress reduction and management, and effective emotional coping. It's important for you to know that changes you make to these risk factors can affect your health and longevity. However, changing these behaviors can be challenging. One model that is helpful for understanding how we change is called the Stages of Change model. This model suggests that change doesn't happen overnight. Rather, change is a process that involves progressing through different stages. Let's use the example of smoking. Starting at the top is the pre-contemplation stage, which is exactly what it sounds like. If you are in the pre-contemplation stage, you might not be contemplating or thinking about making a change in your smoking. Maybe you are not aware that the behavior is causing problems, like making you feel winded when you walk a flight of stairs or putting you at higher risk of blood clots. The next stage is contemplation, in which you might start to develop awareness that the behavior is causing problems. Maybe you are starting to weigh the benefits of smoking, such as providing breaks from work, with the harms, such as the negative impacts to your cardiac health. Then you might move on to the preparation stage, in which you might take small steps toward behavior change, like asking your doctor about smoking cessation aids and telling your family and friends that you are quitting smoking and would like to enlist their help. Now it is time for the action stage. This is when you are actively working to modify the behavior, such as writing out the urges to smoke and making use of smoking cessation aids. The maintenance stage involves keeping up with these changes for a longer duration of time, as well as working to prevent relapses. Lastly, relapse can happen, which is not so much a stage, but more of a return to an earlier stage, such as action or maintenance. Remember, change is not always a straight line, so be kind to yourself if you find yourself staying in a certain stage for a long time, or even returning back to certain stages. The most important thing is to keep moving through the process. There are two key factors for gaining and maintaining motivation to make a change. One is to remind yourself of the importance of this change. How would you like your life to look different if you made this change? What could you do that you could not do before if you made this change? Next, it takes confidence to make the changes. Sometimes we may feel that we lack the ability or skills to make and sustain changes. Consider, what other changes have you successfully made in the past? What strengths do you have that will help you make these changes? Once you have clarified to yourself how important it is to make a change, you will want to spend some time helping yourself feel prepared and confident to get started on the journey. Remember, change happens one step at a time. You just need enough confidence and motivation to take the first step. Your confidence may grow as you begin to make progress, even a little at a time, and gain momentum. The process of small steps and growing confidence will help you build motivation as you go. Another model that is helpful as we think about changing our behaviors is the ABC model. A stands for antecedents, which is what happens before a behavior. These are often called cues or triggers. If you are trying to change your diet, you may want to consider whether there are environmental cues, like what foods are easy to see and easy to grab on your kitchen counter, or personal cues, like feelings of boredom, that are antecedents or triggers to your eating behavior. B stands for the actual behavior. Maybe this is eating a lot of sweets, or overeating during mealtime, or late night snacking after dinner. C stands for consequences or results. We can think about this in terms of short-term or long-term consequences. Short-term consequences might be an immediate feeling like guilt or anger at yourself. Long-term consequences might be related to your health, like increasing low-density lipid levels or raising your blood pressure. The best way to change this cycle is by disrupting the connection between antecedents and behaviors. Behavior change is a process with many stages that requires careful reflection about motivation, triggers, and consequences. Now, let's think about several tools that can help you through this process. Try self-monitoring. Self-monitoring involves noticing a behavior when it is happening, particularly in the moment, and keeping track of the behavior. For example, if you are trying to improve your sleep quality, you might start by tracking when you go to bed each night and wake up each morning, how often you take naps, and how frequently you wake in the middle of each night. As you track your sleep patterns, you can track progress, such as whether you are waking up at a consistent time each day, which is more likely to help you fall asleep at a planned time each night. You may also start to notice patterns to your behavior. For example, do you fall asleep more easily on nights when you haven't had a nap? Do you take longer to fall asleep after days when you've been less active? Once you notice these patterns, you can work to modify these behaviors, such as scheduling a consistent wake time, keeping a consistent routine of daily activities, fading out naps, or late afternoon caffeine. The more you know about your current behavior patterns, the easier it can be to identify those triggers and consequences that are so important to helping to make changes. Once you have begun tracking your behavior and identified areas you'd like to target for change, you can begin to set goals. You might be familiar with the goal-setting method called SMART. SMART is an acronym that guides goal setting. Goals should be specific. Rather than saying you want to be more physically active, you can say that you want to start by walking each day. Goals should be measurable. Goals are easier to track if they are quantifiable. For example, you might decide to achieve at least 5,000 steps every day. Goals should be achievable. Think about how many steps you are currently taking per day. If 5,000 steps seems too high, you might want to start with a lower number. Goals should be realistic. Do you have the time, resources, and physical ability to reach this goal? Finally, goals should be time-based. In how many days do you want to work your way up to 5,000 steps? How long will you want to walk for 5,000 steps a day before increasing your goal? Once you've set a goal for yourself, You can look back to your self-monitoring to identify those ABC patterns of antecedents, otherwise known as triggers, behaviors, and consequences. Ask yourself, what are the triggers that typically come before an unhelpful behavior that is getting in the way of progress toward my goal? Triggers within ourselves and in our environment may become associated with certain feelings or behaviors. The connection can feel almost automatic. Think about how you naturally respond when a traffic light changes from red to green. You immediately start to accelerate without even needing to think much about it. Cues and triggers can also affect our health behaviors like eating, sleeping, stress reactivity, smoking, and physical activity. For example, stress is a common antecedent or trigger for smoking. When we feel stress, we often feel wound up and pressured and like we just need a break. For a person who smokes, taking a cigarette break in response to stress can become an almost automatic behavior. Smoking relieves uncomfortable feelings in the moment, which is a very powerful consequence that reinforces the drive to smoke again in future instances of stress. Unfortunately, of course, we know longer-term consequences of smoking are very harmful to physical health. So, it's important to identify alternative behaviors that could provide relief to stress triggers instead of smoking. Activities like deep breathing, petting the dog, going for a walk to burn off the agitated feeling, or even all three if that's what it takes. Developing a plan ahead of time to respond to triggers with positive behaviors is a good way to protect your health. Triggers can be internal personal factors or external environmental factors. Internal triggers or antecedents are things like emotions, thoughts, memories, cravings, or high or low energy. These can trigger an urge or a behavior. External triggers or antecedents are usually in our environment, such as other people, places, situations, times of day, or objects. Modifying triggers that keep us stuck in unhelpful behavior patterns is important for behavior change. For example, if you know that a trigger such as your television might be a cue for eating unhealthy snacks, you might try to replace the behavior of eating unhealthy snacks with a competing behavior like knitting or petting your dog while you watch movies. If you know that preparing for a deadline at work increases stress, you can plan to take a walk to blow off anxious energy, or spend 5 minutes doing a relaxing breathing exercise on your lunch break. If you know that seeing your jacket and walking shoes handy by the door would make it easier to pop out for a walk, keep them in that spot. That way it'll be easier to increase your daily activity. What if you identify a significant challenge along the way as you work through the process of setting goals, managing triggers, and working toward positive behavior change? Problem solving is a strategy that you likely already use in everyday life, and it can be applied to changing health behaviors. First, clearly define and identify the problem. Maybe the problem is that you have difficulty managing your stress after you come home from work. You may want to start by analyzing the problem. Are you stressed because work was stressful? Are you coming home stressed because you had a stressful commute? Are you stressed because you feel like you have to prepare dinner and take care of your home after work? Next, brainstorm solutions. Maybe you can reorganize your workflow at work, or spend your breaks doing something relaxing like reading a book, so you are not leaving work already having accumulated a lot of stress. Maybe you listen to an audiobook or relaxing music during your commute home. Maybe you and your family each take charge of certain days to cook dinner. Choose a solution and then develop a specific plan. Maybe you decide that you and your family take turns cooking dinner. You can talk about which days each person is responsible for at the beginning of each week. Maybe you have designated days for picking up your groceries ahead of time. Whatever you decide, try it. Evaluate how it is and is not working for you, and rework accordingly. Pre-planning for high-risk situations in which you might be likely to have a relapse and revert to old unhelpful behaviors is also important. Start by anticipating problematic situations. If you are trying to improve your diet, maybe you know that going to family events will put you at risk of eating unhealthy foods or overeating. You can develop a plan ahead of time, such as deciding how much you would like to eat or choosing to sit and eat away from the buffet table so that it is not tempting to pick at more food or get extra helpings. If you are trying to improve your sleep, maybe you know that worrying about finances toward the end of the month makes it more difficult to fall asleep. You can develop a plan to schedule time for planning your monthly budget in the mornings and practice mindfulness or relaxation skills before bedtime. The more specific this plan, the better. Reinforcement is an important part of behavior change because it helps to maintain the behavior over time. Once you achieve a goal, be sure to reward yourself. Doing so makes it more likely that you will repeat the behavior over time. Choose appropriate rewards. For example, if you achieved a dietary goal, rewarding yourself with food might be counter to your goal. On the other hand, if you achieved a physical activity goal, a fresh pair of walking shoes might be just the reward to keep you moving forward. Also think about the timing of your reward. Immediate reinforcement often strengthens the likelihood of repeating the behavior. Keep in mind that rewards can be short-term and long-term. After you work your way through several short-term SMART goals, you may have a bigger reward. There are some good tools available that can help you with self-monitoring, identifying triggers, and practicing positive coping strategies. For example, Mindfulness Coach is an app that can help you practice mindfulness to better cope with stress and other challenging emotions or negative thoughts. Another app, CBTI Coach, can help you practice healthy sleep routines and relax before bedtime. You can also talk to your case manager about making an appointment to work with our behavioral health team if you would like more support toward making positive progress with healthy behaviors. The takeaway points to behavior change are to remind yourself that behavior change is a process. Long-lasting change does not happen overnight. Motivation comes from perceiving the desired change in behavior as important and feeling confident and prepared to make these changes. Finally, use tools like self-monitoring, problem-solving, pre-planning, trigger control, goal setting, and positive rewards as tools to help you through this change process. Thank you so much for your attention during today's lecture.